Hey, it's Brian from Strong Tower Training, brain-based movement coach, and we're doing a series on kinesiology tape. So I got this cool tape today, and I'm going to give you my favorite two applications. The first two here are for the feet. We'll do a series of 5, so actually a total of 5 applications. But first two in this video, I did want to show you today how to cut it. So I have my rock tape here, and I'm just going to cut a piece for the top of the foot. Why would we want to apply rock tape to the top of the foot, or kinesio tape? You can use different brands. We do like rock tape just for how sticky it is. The adherence seems to be better for this brand. For the top of the foot though, we would put the tape there, to increase some blood and nerve supply there. Also for balance. So this piece, I'm just going to show you two quick. I'm going to round the corners. So rounding the corners helps the tape stay on a little bit longer so that it doesn't peel off. When you put socks on, different pieces of clothing on and off can rub on the tape. So that will just make it last a little bit longer if we round out those corners. All right, so that's how to cut. And now we're going to walk through how to apply and again talk about the top of the foot and balance. There's some research on adding sensory information, so can you feel it well, on the bottom of the foot. And the researchers found that when they added sensory to the bottom of the foot, people's balance got better. Another group of researchers came along and said, well, the bottom of the foot works, what about the top of the foot? And they did very similar study where they applied more sensory information, input to the brain to the top of the foot, and they also found that people's balance got better, which is awesome. So one of my favorite applications is the top of the foot, because if you go on the bottom of the foot and you wear any kind of footwear, it tends to wear off really quickly. So I like to go on the top of the foot because even if you wear socks, shoes, and you're putting some daily wear in on those, even things like running, jumping, cutting, this application tends to work better. It just lasts a little bit longer. So what I'm going to do is I took the tape and I peeled, or like ripped it in half, and I peeled back half of that. So now I'm going to stick or adhere the tape on the top of the foot. I do like to go from about the edge of the toes up towards the ankle, and with that piece that's been peeled back, I'm just gonna quickly rub that. That warms up the tape, helps the adhesive stick a little bit better. And then we're gonna take the backing off the second half of that piece of tape and send it the rest of the way down, and rub that part too to make sure that, again, it adheres well. So there's our top of the foot rock tape application. You could test your balance, throw some kinesio tape on, and then retest your balance and find out, okay, hey, does that really help with my balance? Other things that you might notice when you add better sensory information, add some sensory load, in a sense, to the top of that foot, would be maybe less ankle pain, knee pain. It might help with some things like that. Might help your range of motion in the ankle or the foot as well, if you're trying to improve on the mobility or the flexibility in the ankle or the foot. Second application, I got a smaller piece. So this one's pre-cut. Just wanted to keep the video moving. And so on the inside of the foot, inside of the ankle, right below this inside ankle bone, is our medial calcaneus. This area right here is a hot spot for the nervous system, especially when we're talking about the ankle. So what we have here is running through here the tibial nerve. We also have lymphatic flow. So you have lymph vessels and lymph nodes that are gonna basically carry lymphatic fluid out through the knee, to the hip, and then drain it into the circulatory system, helps get toxins out of the body. So for the lower body, lower limb especially, this is an important spot for lymphatic flow. That's our second piece. Our third piece is there's also blood flow through here. So from a circulatory system standpoint, this is also an awesome spot. So you got 3 systems that, putting tape right here, you're gonna see oftentimes an improvement in blood flow and lymphatic flow. So again, just adhering that right below that inside ankle bone. You can rub it for 10-20 seconds, make sure that it sticks well. And if you're somebody that does not react to adhesive, this tends to be pretty safe. If, of course, common sense stuff, you did have any type of reaction, you want to take it off right away. And this isn't medical advice, by the way, but we do tape with a lot of our clients because a lot of people don't react in a negative way, they actually react in a really positive way. Another just tidbit on the lymphatics, the blood flow, the nerve supply, you get a lifting effect when we apply tape. So they've done ultrasound studies where they actually put ultrasound over a piece of bare skin, and then they figure out, okay, when we put the tape on and then run ultrasound on that, how much lift is there? And they actually see, I think it's 4 to 6 millimeters of lift, where there is more space created between the skin and the fascia. So if you think about my hands being stuck together, and there's a nerve and a vein in there, an artery in there, and there's not a lot of space for that fluid to flow through, nerve signals to communicate and flow through. But then if we open that up a few millimeters even, we get better nerve supply, better blood supply. So awesome one inside of the ankle, and then again for balance, top of the foot. Those are my first 2 out of 5 favorites for kinesio tape.